നമസ്കാരം.
നമസ്കാരം.
എല്ലാ പ്രിയപ്പെട്ട പ്രേക്ഷകർക്കും നിങ്ങൾ കാത്തിരുന്ന ചുങ്ക ജ്വല്ലറി ലേഡീസ് അവരുടെ ഇന്നത്തെ എപ്പിസോഡിലേക്ക് സ്വാഗതം. ഇന്നത്തെ എപ്പിസോഡിൽ നമ്മൾ സംസാരിക്കുന്നത് ഒരു പ്രത്യേകതരം ലൈറ്റ് ഹൗസിനെ കുറിച്ചാണ്. ഈ ലൈറ്റ് ഹൗസിൻ്റെ ഏറ്റവും വലിയ പ്രത്യേകത എന്ന് പറഞ്ഞാൽ ഹിസ്റ്ററിയിൽ റെക്കോർഡഡ് ആയിട്ടുള്ള ഏറ്റവും ആദ്യത്തെ ലൈറ്റ് ഹൗസ് ആണിത്. അത് ഫാറോസിലെ ലൈറ്റ് ഹൗസ് ഓഫ് അലക്സാൻഡ്രിയ എന്ന് പറയുന്ന ഫാറോസ് ലൈറ്റ് ഹൗസ് ആണ്. അപ്പോൾ ഈ ലൈറ്റ് ഹൗസിൻ്റെ ചരിത്രവും എല്ലാം പറഞ്ഞു തുടങ്ങാം അല്ലേ?
ഈ ലൈറ്റ് ഹൗസുകൾ എന്ന് പറയുന്നത് കപ്പൽ യാത്രികർക്ക് രാത്രിയിലുള്ള ആ ഒരു ജലഗതാഗതം വളരെ സുഗമമാക്കുന്നതിന് വേണ്ടിയിട്ടാണ് ലൈറ്റ് ഹൗസ് എന്നുള്ള ആ ഒരു സംവിധാനം ആവിഷ്കരിക്കപ്പെട്ടത്. പിന്നീട് നമ്മുടെ കേരളത്തിൻ്റെയൊക്കെ ഒരു അവസ്ഥ ശ്രദ്ധിക്കുകയാണെങ്കിൽ തീരപ്രദേശം ഒരുപാടുള്ള ഒരു സംസ്ഥാനമാണ് കേരളം. അതുകൊണ്ട് തന്നെ കേരളത്തിലൊക്കെ ഒരുപാട് ലൈറ്റ് ഹൗസുകൾ സ്ഥാപിക്കപ്പെട്ടിട്ടുണ്ട്. ഇവിടെ വിഴിഞ്ഞത്താണെങ്കിലും ഇനി കോഴിക്കോടാണെങ്കിലും കൊച്ചിയിലാണെങ്കിലും ഒക്കെ ലൈറ്റ് ഹൗസുകളുണ്ട്. ലൈറ്റ് ഹൗസിന്റെ ഒരു പ്രാധാന്യം ഇപ്പോൾ ഒരുപാട് പേർ അത് ഉപയോഗപ്പെടുത്തുന്നില്ല എന്നുണ്ടെങ്കിൽ തന്നെയും ഇപ്പോഴും ഉൾക്കടലിൽ മത്സ്യബന്ധനത്തിന് പോകുന്ന സാധാരണക്കാരായ മത്സ്യത്തൊഴിലാളികളൊക്കെ ഈ ഒരു ലൈറ്റ് ഹൗസിനെ ആശ്രയിച്ചാണ് ഒരുപാട് കാര്യങ്ങൾ ചെയ്യുന്നത്.
മത്സ്യബന്ധനത്തിനല്ല, ഏതൊരു കപ്പലും കടലിൽ പലപ്പോഴും നമുക്ക് ദിശ അറിയില്ലല്ലോ. അപ്പോൾ ഒരു മാഗ്നറ്റിക് കോമ്പസോ എല്ലാം വെച്ചിട്ടാണെങ്കിൽ പോലും നമുക്ക് എത്രത്തോളം സഞ്ചരിച്ചു എന്നുള്ളത് മനസ്സിലാക്കാൻ ഇപ്പോൾ ഒരു ഷോറുണ്ട്, ഒരു ലൈറ്റ് ഹൗസ് ഉണ്ടെങ്കിൽ അതൊരു ഷോറിന് അല്ലെങ്കിൽ ഒരു കരയ്ക്ക് അടയാളമാണ് എന്നുള്ളതും പലതരത്തിലുള്ള ഇൻഡിക്കേഷൻസ് ആണ് പലതരത്തിലുള്ള ലൈറ്റ് ഹൗസുകൾക്കുള്ളത്. അപ്പം ഇത്തരത്തിൽ ഫാറോസ് ലൈറ്റ് ഹൗസ് എന്ന് പറഞ്ഞാൽ ശരിക്കും കടലിൻ്റെ വളരെ അടുത്ത് തന്നെയായിരുന്നു, ഉൾക്കടലിലാണ് എന്ന് പോലും സൂചനകളുണ്ട്. ശരിക്കും 2050 BC-യിലായിരുന്നു ഈ ഒരു ലൈറ്റ് ഹൗസ് ആദ്യം, ഈ ലൈറ്റ് ഹൗസിനെ കുറിച്ചുള്ള ആദ്യ രേഖകളുള്ളത്. ഇന്നും
ഏതായാലും ഈ ഒരു ലൈറ്റ് ഹൗസിനെ കുറിച്ചും ലൈറ്റ് ഹൗസുകളുടെ പൊതുവായ ചില വിശേഷങ്ങളെ കുറിച്ചും ഒക്കെയാണ് നമ്മളിന്ന് സംസാരിക്കുന്നത്. ആദ്യ സെഗ്മെന്റിന് ശേഷം മടങ്ങി വരാം.
Namaskaram, I am Dr.Swathi Padmanabhan. I am a pediatric consultant and today I am here to talk about breastfeeding. Why breastfeeding? Actually, every year the first week of August is celebrated as breastfeeding week. உலகத்துல மொத்த உலகமும் ஒரு வாரம் ஃபுல்லா breastfeedingக்கு இவ்வளோ இம்பார்ட்டன்ஸ் எதுக்காக கொடுக்குறாங்க? பிகாஸ் breastfeeding is very essential and very important, and breastfeeding to your baby is also that important. So that's why it's given so much importance that the whole week is dedicated for breastfeeding. So what is the importance of breastfeeding? It can be divided into like the importance given to the baby and importance to the mother. So when it comes to baby, it is said to be the ideal food for the baby, because until 6 months of age, the baby's stomach and the intestines can only digest the baby milk and nothing other than that. So it is said to be the ideal food. Secondly, it is also the first immunization that you give to your baby, because our mother's milk has all the properties which would improve the immunity for the baby. And secondly, it is the mother's gift. It is the best mother's gift that anybody can give to a baby. Thirdly, it improves the immunity and prevents illnesses in the baby. So adikadi infection varam irukkiradhukku tadukkum. So breastfeeding is very very important. Lastly, it also improves the IQ of the baby. So these are the importance of breastfeeding in a baby. What does breastfeeding does to a mother? So ஒரு அம்மாக்கு breastfeeding நால என்ன பிரயோஜனம்னு பார்த்தா, முதல்ல it helps in losing weight. பிரசவத்தினால இன்க்ரீஸ் ஆன வெயிட் எல்லாமே mother can lose by breastfeeding. Secondly, it improves the bonding. அம்மாக்கும் குழந்தைக்கும் இருக்க bond and love will improve by breastfeeding. Thirdly, it prevents certain cancer like breast cancer, ovarian cancer, எலும்பு ப்ராப்ளம், அதெல்லாம் வந்து breastfeeding prevent பண்ணும். மூணாவது, ப்ரெக்னன்சினால யூட்ரஸோட சைஸ் எல்லாம் பெருசாக இருக்கும். ஸோ அதோட சைஸ் நார்மலாக திரும்பி பழைய மாதிரி ஆகிறதுக்கு breastfeeding helps. Last but not the least, the most important thing is breastfeeding is a natural birth control. So breastfeeding mothers, breastfeeding itself acts as a birth control. So these are the benefits to the mother and the benefits to the baby. In this show, we are going to talk about certain important facts regarding breastfeeding. Firstly, how to feed the baby, when to feed the baby, what all to feed the baby, and more importantly for working mothers, how to express, store the milk and how to reuse the milk, and certain frequently asked questions or doubts by the patients to us doctors. So let's go one by one. The first thing is when to start feeding. Breastfeeding can start can be started as early as 1 hour after delivery. So post delivery, within 1 hour, breastfeeding must be initiated. If it is a normal delivery, the baby can start feeding immediately at the table once the umbilical cord is cut. Adavadhu toppul kodi cut cheyadadum immediate ave we can start breastfeeding. In cesarean mothers, you can give a time lapse of 1 hour, but first hour the feeding is very, very important. And how long to feed the baby? First 6 months, the mother should feed only breast milk and not even water. So only breast milk. This is known as exclusive breastfeeding. This is very, very important, and every mother should strictly follow to give only breast milk, because even water is not necessary when you feed milk alone. Thirdly, how long can you give? For 6 months, when you are giving exclusive breastfeeding, at the start of 6th month, you can start giving semi-solid foods. So at that time, you have to continue feeding with milk, with the breast milk. Up to 2 years, you can feed the baby. So this is how long and when to start feeding. Now, how to feed, how to give a breastfeed. The first important point is posture. Every mother should sit comfortably and before start to feed the baby. Sitting comfortably with the back rest is very, very important. And very, very important point is that no baby should be fed on the lying down. Kadandittu endha kuttikkum paal kudikka koodadhu. That is very, very important, because it can cause infection in the ear, kaad infection varalam, illa chest infection varalam. So eppom you have to sit and only feed the baby. And how to position your baby. So always you should hold the baby where the head is placed on the elbow joint, and the body should be in straight line with the head, and the baby should touch the mother's body. The connection between the baby and the mother should always be there throughout the feeding process. So this is the position. Second is latchment. What do you mean by latchment? How can you make the baby take the feed? So first thing is, the baby's mouth should be widely open, and you should be able to see both the upper lip and the lower lip. That is very, very important, and the nose must not be blocked by the breasts, so that the child doesn't have breathing difficulty while feeding. So this is very important, and you have to be interactive with the baby. So while feeding, the mother should try to interact, interaction with others or distraction by watching TV or something should be reduced, because this is the time you spend with your baby. So try to interact with your baby in a quiet room and feed the child. So how long you should feed the child? This is also very important. Every time you feed your baby, you should feed for at least 20 to 30 minutes. So why this 20 to 30 minutes? Because every time when you feed the baby, there is 2 types of milk which is being secreted. That is the hind milk and the fore milk. So the fore milk and the hind milk. So the first 10 minutes, the milk which is secreted is watery. That is 18% of the milk contains water. The second part of the milk only contains micronutrients and the fat. So first, when the baby takes milk for 10 minutes, the thirst will go. Thagam teendadum kutti orangi povum. But at that time, what you should do is, you have to wake the baby and feed for another 10 minutes. So the 20 minutes is very, very essential for the weight gain of the baby. So, and every time when you feed the baby, you should feed in your alternate sides. So not always one side should be fed. The next time when you are feeding, you should feed on the other side of your breast. This is very, very important. So now let's see how frequently we have to feed the baby. Initially, it is important that you feed the baby every 2 hours once, and it is not like a clicked calendar type, or you have to set an alarm every 2 hours. No, that is not how it is. It is set to be you have to feed the baby every 2 to 3 hours, and also according to the need of the baby. Certain babies might require more frequently. That is when you don't give adequate feeding every time you feed. So when you follow this 20 to 30 minutes, every 2 hours or every 3 hours feeding is more than enough. Now moving on to the most commonly asked doubt. Every mother says, "Enakku paal pattala, paal illa, what should I do? What should I do to increase the milk secretion in a mother?" This is asked day in and day out by all my patients. So what you have to do is 5 things. First and foremost is, a happy mother can secrete more milk. So you should keep your mind stress free and very positive when it comes to feeding your baby. So here the family and the husband plays a very vital role. So they should make sure that the mother is not given any emotional stress or physical stress by letting her rest properly and feed the baby. Third is rest. Yes, very important. The first 6 months, mother should be given adequate rest. If not at least the 6 months, at least the first 3 months, the mother must be given complete rest, and even working mothers should take leave and feed the baby. At least for the first 3 months, she should take rest. Thirdly, she should take adequate nutrition. That is, you have to take proper meals. That is 4 meals other than your breakfast. So, including your breakfast, you have to take 5 meals with good nutritive value, not junk food. So, you have to take good amount of vegetables and green leafy vegetables in your diet. This is very important. And lastly, you should keep yourself very hydrated. You have to keep drinking a lot of water than how you did normally, and even other fruit juices or any fluids. So, keep yourself hydrated to feed your baby. Now, coming to the most important part of this talk, that is my advice to working mothers, because working mothers, they cannot take long leaves like for 6 months straight. So, how can they feed their baby? So, they tend to buy tin milk or the powder milk, and they prefer over breast milk. So, that is completely wrong. So, I am here to insist on the point that even if you are a working mother, you can still feed your baby exclusively with breast milk for the first 6 months. But how? So, here comes the technique where you can express the breast milk, safely store it and reuse it. So, how do you express your breast milk? So, there are 2 ways in which you can express. One is the manual expression, that with your hands you can express your breast milk. Secondly is using a breast pump. There are various breast pumps available in the market. There are so many breast pumps with so many technologies and all that. So, here whether to do a manual expression or using a breast pump is completely a mother's choice. So, if you are affordable to buy a breast pump, yes. If you feel that is more easier and time consumingly less, yeah, you can go for a breast pump. But scientifically speaking, manual expression is any day better than breast pump, because it is more gentler on your breasts, and it induces or increases the secretion of the hormone that is required for breast milk production. So, in that way, when you compare, manual expression is better. But when you come to the comparison in which infection, to prevent infection or to in a very good way how to collect milk, both have the same advantage and the same disadvantages. And when you are storing, it is very important that you put a sticker writing down the date when you collect it, and even the time and the quantity, so that it is easy for you to use it and you will know when you collected it. So, now we have stored the milk. Now, how to take it and use it? So, freezed milk should be boiled, obviously should be boiled. Now, what is the disadvantage of boiling freezed milk? Yes, some amount of nutrition will be lost when you are boiling the milk, but it is definitely still better than the powder or the tin milk. So, now let us see how to clean the container that you have used to store. This is also very important. So, parents ask me, should I sterilize the container? No, that is not at all necessary. You do not have to sterilize the container, but you can wash it cleanly with soap and water like how you wash any other utensil, but air dry it, or you can use a paper towel to dry it. Do not use any cloth that might be dirty or something, you might introduce infection to the container. So, it is highly important that you air dry it, or you use a new tissue paper towel or something to wipe it. So, that is how you clean the container. Okay. Next most commonly asked doubt is, baby who has been given formula feed or the tin powder milk looks chubby and more healthy than a baby who is taking only breast milk. Yeah, they will look chubby because the breast milk and the tin milk is not of the same formula. There is more fat in the tin milk, and that makes the baby look more chubby. So, chubby babies look cute, but that is not healthy chubbiness. So, that kind of chubbiness is not necessary for our child. So, just breast milk is more than enough. Next question is sore breasts or cracked nipples. This almost every mother will go through in their breastfeeding period, and I will tell you certain things how to avoid getting cracked nipples. First thing is right technique. When you follow the right technique, cracked nipples, you can avoid cracked nipples. Secondly, you should not frequently wipe or clean your breasts when you are before or after feeding. So, coming to the next frequently asked question is engorged breast, that is எனக்கு பால் கட்டி இருக்கு ரொம்ப வேதனையா இருக்கு அப்ப நான் என்ன செய்ய அப்படி so many parents ask me this. how do you treat once it becomes kattiyan appram enna cheyanuna very frequently you will have to express the milk. பால் எடுத்து விடணும். இல்லை you can feed the baby frequently. If there is more swelling, ஜாஸ்தி வீக்கம் இருந்தால் அடிக்கடி பால் எடுத்து விட்டு you can store the milk and keep. And other than that you can actually give a cold press or a hot press. Certain mothers hot ஒத்தடம் வச்சா நல்ல improvement இருக்கும். But சில mothersக்கு hot ஒத்தடம் can worsen the வீக்கம். So in that case you can use a cold press. Cold press எதை வச்சு செய்யலாம் அப்படின்னா you can use a frozen cabbage. So ஒரு cabbage leaf வந்து keep it in the freezer, make it nice and cold. Then you can make a hole in the center and you can apply to the breast and it can stay for some time. So in that case you can even feed the baby while it is on your breast. So this will reduce the swelling. And வேதனைக்கு you can take a simple paracetamol. Nothing else needs to be done. Now last and most important thing is regurgitation. அதாவது தலைக்கு ஏறுறது. பால் கொடுத்ததும் பாப்பாக்கு தலைக்கு ஏறுது, அடிக்கடி தலைக்கு ஏறுது, அதுக்கப்புறம் சொம்மை வருது அப்படின்னா என்ன செய்யணும்? Very very important. This is a very very important and concerned thing. So தலைக்கு ஏறுறது is very very dangerous because even a micro drop is enough to cause chest infection. லங்குக்கு போச்சுன்னா இன்ஃபெக்ஷன் வரதுக்கான வாய்ப்பு ஜாஸ்தி உண்டு. So you should prevent aspiration or regurgitation, that is தலைக்கு ஏறுறது. How can you prevent? Feeding செய்ததும் you have to put the child on your shoulder and burp for 15 minutes as I have told you before. Secondly, பெட்டில் படுக்க வைக்கும்போது ஒரு 15 டிகிரி ஆங்கிளில் குட்டியை படுக்க வைக்கணும். இது ரெண்டு செய்தும் அடுக்கடுக்கே வந்து தலைக்கு ஏறுது அப்படின்னா you definitely have to consult a doctor and we have medicines to stop that. So we can try treating the baby with medicines. So don't ignore an aspiration of breast milk. அதாவது தலைக்கு ஏறுறது ஒரு சாதாரண விஷயம்னு இக்னோரே பண்ணக்கூடாது. So these are the most important and very frequently asked doubts by the mother. Lastly, I would like to conclude saying that breastfeeding is not a choice. It is a responsibility. So every mother's responsibility is to give your breast milk for your baby exclusively, that is without giving anything else for 6 months is a responsibility. So please take that responsibility seriously and do it. Thank you.